So bronchial thermoplasty, I'm not sure if how familiar everybody is with this, but this is also one of the emerging therapies for asthma. And what is known is that there are a lot of physiologic changes in asthma, and changes in airway smooth muscle is one of them. So the smooth muscles can be hypertrophied. These allergic cells and mast cells can start to get into those airway smooth muscle. And the smooth muscle is a really important effector of bronchoconstriction. And so patients with asthma are going to have changes in their airway smooth muscle. And so it is postulated that, is there a way to target that airway smooth muscle to better treat asthma? And so the bronchial thermoplasty is basically based on the idea that if there's an application of radio frequency energy to the airway, and this is typically done beyond the main stem bronchi down to these smaller airways, that this delivery of thermal energy can reduce the load or reduce the mass of the airway smooth muscle. And by doing so, it can help asthma control. So a lot of this first started off animal models that showed benefit in models of increased smooth muscle hypertrophy with this procedure. And there's been several studies that have looked at this in humans, which have ultimately led to FDA approval for the procedure. So it's approved for severe persistent asthma in adults. It has to be in patients that are not well controlled on high-dose inhaled steroids and LABAs. And some of the contraindications include that patients cannot have some sort of electronic device like a pacemaker. They have to be able to tolerate bronchoscopy and all the medicines that go into having a bronch, and they can't have active infection. So what exactly is it? So these patients with severe refractory asthma are evaluated to figure out if they're a good candidate for the procedure. And what it is, it's 3 separate bronchoscopy sessions. So once they're deemed a candidate for it, they basically have 3 separate bronchoscopies arranged, typically it's not like one day after another, it's spaced out. And the patients are treated with steroids for several days leading up to the procedure. They come in, spirometry is done to make sure that their breathing is at baseline. They can't have an active infection. And then what happens is they pick 3 segments and they basically do a bronchoscopy. So the bronchoscope is inserted, and then there's an electrode basket that's fed through the bronchoscope that's seen here. That's put down into the airway, and this little basket is then basically touching the wall, and energy is delivered. So this is thermal energy that's delivered through the airway wall, and it's ultimately affecting the airway smooth muscle. And this is done at 5 millimeter increments. So it's done here, this electrode is pulled back, it's done here, and it's done all the way up the airway at various points. And depending on the patient, this typically takes about an hour. The patients are then monitored in the bronchoscopy suite, and in most cases, the patients are able to go home thereafter. This happens 3 separate times. And so I have a quick video I just wanted to show you of the actual procedure.